gospel that's awe-inspiring yet easy to understand and appreciate. Let us all listen to the Word of God here on The Word Exposed on Air. Only on Radyo Katipunan 87.9 FM.
A new school year is here.
And as our campus comes alive once again, let's also do our part to keep everyone healthy and safe.
The rainy season brings an increased risk of illnesses like flu, dengue, COVID-19, and other viral infections.
If you're feeling unwell, whether it's a fever, cough, cold, sore throat, or body aches, stay home, consult a doctor, and avoid exposing others.
Protect yourself and those around you by eating healthy, staying hydrated, getting enough sleep, washing your hands regularly, and keeping your surroundings clean.
If you're in a crowded place or experiencing respiratory symptoms, wear a properly fitted face mask. Remember to dispose trash properly to prevent mosquito breeding.
Be extra careful during rainy days and always follow campus traffic and safety rules. Slow down. The campus speed limit is 30 kilometers per hour.
A healthy community begins with healthy individuals. Every small act of care helps protect classmates, co-workers, friends, and families. Let's work together for a healthier, safer, and happier Ateneo community.
This is a public service reminder from the Office of the Assistant Vice President for Health, Care, and Well-Being and Radyo Katipunan 87.9 FM. Your one big FM.
The voice of the Radyo Katipunan.
Checking out the latest happenings in, around, and beyond Katipunan. This is the Katipunan Roundup.
This National Heroes Day, be a hero for your health, your community, and your furry friends. Join the Philippine Dental Association Quezon City Dental Chapter Incorporated for Fun Run with Pets 2026. Happening on August 31, 2026 at the Ninoy Aquino Parks and Wildlife Center in Quezon City, this fun-filled event celebrates the hero in all of us. Run, walk, and bond with your pets while promoting health and wellness, mental well-being, responsible pet ownership, and community spirit. And there's more! Your participation helps raise funds for the charitable and community outreach programs of the Quezon City Dental Chapter, directly benefiting communities and charities they support. So bring your family, bring your friends, and most importantly, bring your pets. This National Heroes Day, let's prove that every act of kindness can make a difference. Fun Run with Pets 2026, August 31 at Ninoy Aquino Parks and Wildlife Center, Quezon City. Be active, be compassionate, be a hero with your pet.
The voice of the Radyo Katipunan.
Checking out the latest happenings in, around, and beyond Katipunan. This is the Katipunan Roundup.
The voice of the Blue Eagle. Radyo Katipunan 87.9.
Radyo, 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 Katipunan. Radyo Katipunan. Radyo Katipunan. Radyo, 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 Katipunan. Radyo, Radyo, Katipunan.
The voice of the Blue Eagle, kami di mapipigil sa pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng eskwela. Radyo, Radyo, Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Katipunan. Kawan ni Ignacio, Katipunero sugo, todo sa kayod, tulong at tulong. Ipag the Blue Eagle, galing hiding at higil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Radyo, Katipunan.
Coming up next, Wellness Wednesdays on Radyo Katipunan 87.9 FM.
Radyo Katipunan.
Radyo, 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 Radyo Katipunan. Radyo Katipunan. Radyo Katipunan. Radyo, Radyo, Radyo Katipunan. Radyo, pagbabalitang tumpak at tama. Buhay Atenista, sa loob sa labas ng eskwela, ating ibibida lahat ng kwela. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Katipunan. Kawal ni Ignacio, Katipunero sugod, todo sa kayod, dunong at tulog. Lipat na Blue Eagle, galing giting nagigil. Blue and white, one big fight. Radyo, 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 Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan. Katipunan. Radyo, 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 Katipunan. Radyo, Katipunan.
We all want to live healthier in mind, body, and spirit. But where do we start? Sometimes, all it takes is a good conversation. Tune in to Wellness Wednesdays on Radyo Katipunan 87.9 FM. Together with experts, inspiring guests, and real stories, we explore tips you can actually use. From managing stress, to eating better, to finding balance in a busy world. Because here, we believe wellness isn't just about living longer, it's about living better. So join us, and let's make every Wednesday a step toward your healthiest self. Wellness Wednesdays, wellness that speaks to you, from the body, mind, to might. Every Wednesday on Radyo Katipunan 87.9 FM.
Okay, good afternoon and magandang hapon mga ka-RK. Welcome back, okay? So, well, at least for us, no? So, welcome to Wellness Wednesdays. Wellness that speaks to you from the mind and body to the mic. Again, I'm Doc Shaw, your university physician from the Healthcare and Wellbeing Cluster. Okay? We're here, of course, every fourth Wednesday of the month to facilitate our discussions on health and wellness, grounding it to our daily challenges and issues, no? In terms of living a healthy life. Okay? So, ayan.
And I'm Mia Fadriquela, also from the HCW, or Healthcare and Wellbeing, as a health program officer. So nakaka-excite today. I think we have a very relatable topic, no? And we have a special guest today, actually.
So I'm Doc Izzy. I am an occupational health physician, which means I work at the intersection of health and the workplace. And I'm glad to be here today because today's topic is something that's at the center of what I do as an occupational health physician.
Yeah, we're so happy that after many tries, pumayag po si Doc Izzy, no, for this edition. Okay, so today we will be talking about the annual physical exam, or the APE. Okay, of course, it's something a lot of employees encounter, no, in different companies at once a year, no, kasi required by law yan. We'll talk about that later. Okay, and yet, no, kahit na it's just once a year, it's really probably one of the most important health touch points available to the employees. Okay? So today we want to demystify it, no? Ano ba talaga 'yan? Ano ba nangyayari? Para saan ba 'yan, no? How do we make the most of your APE?
So hopefully by the end of this episode, you have a more comprehensive understanding of what an APE is.
So, hi bar, Miss Mia. Let's meet it.
Relax lang, Doc Izzy, no? But ano muna tayo? Tawag mo dyan, relax muna tayo. So let's try to do our brain boost, okay? So, true or false lang ito, no? I'll try to provide the scenario, and then we want our listeners to chime in also, hopefully sa live chat, okay? So, the annual physical exam is mainly for finding out if you're sick. True or false?
So that statement is actually false. So the physical examination is mainly a preventive tool, not a diagnostic one. So what we want to do first is, in line with your pre-employment, is to establish a baseline first. Along with that, we try to catch the early warning signs of any illnesses before symptoms actually appear, and to give or to get a picture of your health over the time of your employment. So finding illnesses during APE is just a byproduct but is not the main purpose of it.
Yon, malinaw po yun, no? So, hindi yan hinahanapan ka lang ng sakit. So, that's why some people dread, no, na ayaw magpa-APE. Kasi baka mahuli sila, then ang worry nila, baka patigilin sila sa trabaho. But that is exactly the point, no? And we want to keep coming back to that. This important shift in mindset, no, from being reactive to preventive care is something that we value here in the university as well, no? So remember, the APE is not a test that you want to pass, no? And it's not about failing. Hopefully, you treat it as a conversation with your doctor. Okay? So again, sana hindi natin siya isipin na exam na kailangan nating ipasa, rather maging tapat, no, to be for that to be a real conversation, so that makita kung ano talaga yung mga kailangan bigyan ng pansin in terms of our own health.
All right. Okay, next question. True or false? If you feel healthy, there's no point in getting an APE.
So once again, that statement is false. And this is probably the most dangerous misconception about APEs. A lot of the conditions that we screen for the APE, like elevated blood pressure, the presence of sugar in the urine, or any signs of kidney issues, they are usually silent in their early stages. No symptoms, there are no symptoms, no warning. You're completely fine up until you are not, when you start to develop symptoms. And when you develop symptoms, that is usually when there's already damage to the organ.
Yan. So from a population health point of view, that makes your APE so valuable. It's a source of information, no, that will help health professionals, design their programs, but also addressing the individual needs, that will also help tailor fit kung anong diagnostics ang kailangan, ano pa yung mga pwedeng modifications of behavior that we can recommend to, again, address the health issues of our patients, or in this case, our employees undergoing the APE.
All right. So if you do the APE, it's not just for yourself, but also for the wider community, no, Doc?
Oo. Kaya nga, this is the window where we can make a big difference, no? Yung between yung lumabas na do sa conversation while you're doing your APE, kasi mas accurate yung pag-fill up ng forms, no? And then pag na-proseso na yung form, yung pag-collate ng data, and then pag-analyze kung ano yung mga, how to interpret those results, no? And the information that we give sa history taking, yan yung makakatulong para mas maiwasan yung mga complications ng pagkakasakit.
All right. So last question. True or false, the APE is really just a box-ticking compliance requirement for employees?
Okay, that's partially true, and to be honest, yes, APE is required by law under the Occupational Safety and Health Standards. But there's importance in, aside from meeting the compliance, the value of the data that you get from APE is something that needs to be used by your occupational health professionals in developing the programs for your workplaces.
Yan. So, hindi yan basta form lang na sinasubmit sa HR, no? Pinag-aaralan po namin yan, no, sa University Clinic. And it's important, no? It's important na we get honest and correct information. Alright? And then, because hindi lang naman yan basta numbers, as we will see later on, no? Hindi lang yan whether mataas ang sugar o hindi, mataas ang blood pressure o hindi. We need to be able to connect, no? Yung pag-examine sa pasyente at doon sa mga test na lumalabas. The good thing about this APE, it's done in a should be in a relaxed, non-pressured moment, no? Hindi nirarush. Kasi kaso nga, ang problema minsan yung mga APE natin, lahat ng tao nagmamadali. Ayaw pumila, pero pag nandun na sa dinadaanan ng mga proseso, naiinip. So, gusto na lang basta matapos, not realizing that every bit of information will have its value.
Alright, so we've been talking about APE, but what is really an APE? What does a full APE look like?
So, a full APE, as mentioned by Doctor, should ideally be done in a stress-free time. No? At its core, contains three components. First of all is the medical history, wherein there is a review of the patient's current health status, the history of their past illnesses, any medications that they're taking, the family's medical history. Even we look into the patient's social or their lifestyle history. Then the next component is the physical examination, wherein there is a hands-on assessment by the examining physician. Ideally, it's done by an occupational health physician, but locally, it's mainly done by the general practitioners. And this covers the vital signs, the examination of the different organ systems, and correlating the clinical findings based on the physical examination. The third component is the diagnostics, the laboratory exams, wherein we do blood works like complete blood count. We also do urinalysis, chest X-ray, ECG, and other diagnostic tests that really depends on the patient's age and other risk factors in terms of their work.
Okay. Pabalikan ko yun, no? Yung history taking, no? Kahit sa med school, tinuturo yan, no? Na importante yung thorough history taking, no? Kasi sabi nga ng mga consultants na mga professors namin, if you do well your history, you would probably gain at about 70% of your diagnosis already, no? Kaya nga dapat tatsagain talaga at magiging tapat dun sa pagsasabi ng mga past medical history, family history, dahil mahalaga yan. As we will see later on, may difference kasi yung value, yung doon sa konteksto kung paano nakuha yung blood pressure na ganito, yung blood sugar na ganito. Okay? So remember that if we are able to enrich, no, the information from your APE, then we can further adjust yung mga sinasabi nga na diagnostics na kailangan pa, no? We'll talk probably more about those diagnostic texts later on.
So true as to what Dr. Shaw said, that wherein the patient's history plays a key role on what test do we request based on not just on the patient's personal medical history. For example, a 35-year-old, relatively normal BP except na medyo mataas ang diastolic. So that is the lower part of your BP. Medyo mataas ang diastolic BP. Pero meron siyang immediate family members that has history of hypertension. We become more proactive in how we monitor this patient. So we add in other tests like your lipid profile, your FBS, versus let's say a 35-year-old na relatively no significant family medical history. So it really differs depending on the history that we elicit from those patients.
Yeah. And then sayang rin yung pagkakataon na yun no? Yung lagi ko nga sinasabi, sa pagka may mga ganitong mga history taking sa consultation, doon mo na rin maisisingit yung yung education and health promotion. Sana maging pagkakataon na rin yon, no? Kasi kung magmamadali kayo, gusto lang matapos, wala na, isang tanong, isang sagot. That's not gonna do much, no, for the yung magiging outcome ng proseso. So mahalaga nito, no, bigyan ng kumbaga mas maging explain further. In other words, try to elaborate further yung hindi lang basta kwento kung ano yung mga mahalagang detalye, no? Of course, challenge minsan yan kasi syempre sa untrained person hindi malinaw o mahalaga ba tong information na to, no? Kaya nga wag na natin unahan ng judgment yon. Kwento mo lang, no? Kung kahit na sabihin natin sa tingin mo maliit na detalye, baka malaki pala yung detalye na yon in terms of making a full assessment of the patient. So, kwento-kwento lang. Kasi doon makikita yung, as mentioned, no, yung mga risks nung exposure nung pasyente. Mag-guide yon sa doktor in terms of diagnosis, but also, like I said, no, doon makakapagkaroon ng exchanges in terms of promoting healthy lifestyles.
So it seems like the history provides an opportunity, number one, and number two, the context behind the numbers. No?
Yes, definitely. Alright, so, sige, second part tayo, Doc Izzy. Physical examination. Ano ba talaga yung physical examination?
So, as mentioned earlier, we look into the vital signs of the patient. So, what are the vital signs that we look into? One is the blood pressure. Favorite na ng employees. Anong baby ko, Doc? Mm-hmm. Okay. Next is we look into the heart rate. The respiratory rate, we also look that into the temperature of the patient when they come in for their annual physical examination, oxygen saturation, and BMI. So, this alone are quite informative. This gives us an idea of generally how the patient is. Next, we do a systematic review of the organ systems. We look at the heart, the lungs, we examine the abdomen, we do a examination of the musculoskeletal system. So yan yung paminsan, pinapatayo, upo, squat kayo. Neurological reflexes, the examination of the skin. We check for signs of any rash or any signs of deformities or even tattoos. We take note of that, no? The eyes, the ears, and for age-appropriate patients, no, we also do some reproductive health screenings. So this can be, for example, your breast examination.
Okay. So talagang kailangan thorough, no, from head to foot, no? In a regular consultation kasi minsan hindi na napapansin yun dahil nga nagmamadali both the doctor and the patient. So sana the ideal as we said, no, yung ideal doon ay mas maging magbigay ng panahon para you can do a more complete not just history taking but even physical examination. No? Okay. Balikan ko lang ng konti yung blood pressure, no? Sabi mo nga ilan ang madalas itanong ng mga tao, Doc, low blood kasi ako di ba? Or Doc, high blood daw ako. Then tatanungin mo sila, alam mo ang pagkaintindi mo ng low blood? Alam mo ang pagkaintindi mo ng high blood, no? And then, yun, opportunity yun kasi para magkaroon ng learning experience or learning exchange between the doctor and the patient, no? Yung pagpapaliwanag nga, no? Iba yung madalas maririnig mo kasi, borderline ako di ba? Ano ibig sabihin ng borderline? Borderline ng diabetes ko, borderline ang blood pressure ko. Again, babalikan natin doon yung konteksto. Yung 120/90 At yung 120/80, for instance, may difference yun based on, halimbawa, sa edad ng pasyente. Or so yung sinabi kanina na yung risk factor dun sa family. No? Kung ikaw ba ay may pamilya na marami nagka-high blood, naggagamot, or yung pamilya na laging or pamilya na may lahi, sinasabi nga, lahi ng diabetes, no? So, doon mo ibabangga yung numero. Huwag tayong masyadong ma-focus lang. But, lagi kong sinasabi sa mga estudyante yan, no? Yung numbers, the values of these statistics, okay? We need to realize that while they show and tell us things, sometimes the important question to ask is, what are those numbers also not saying? Diba? May joke nga lagi diba? Sabi, yung statistics daw parang bikini daw yan. Okay? What they reveal might be very suggestive, but what they conceal actually mas vital. Okay? Sige, balik na tayo.
Yeah. So, actually, Doc Shaw already touched it a little bit na wherein there are also some other things that you look into, no? So, in cases like for some types of work, no, in the context of occupational health, no, it's not just the usual physical examination wherein we check the lungs and the heart and everything. Depending on the work, we do additional tests for work-related hazards. For example, for BPO employees, which are very much dependent in their hearing, we do additional tests for their for their hearing, basically. Sorry. Or for drivers or those who are very dependent with their eyes, no, we do additional visual examination. So hindi lang yan yung pagbasa sa pag-check ng visual acuity, yun yung nagbabasa kayo ng eye chart, no. We do also check for their depth perception, no, or for those na who have physically demanding jobs, no, we also check sometimes their physical strength. No, kaya ba nilang mag-squat ng todo? Kaya ba nilang tumalon, no, from to a certain height, no? So we tend to calibrate the annual physical examination depending on the type of work employees do and the type of workplaces that they work in.
Yeah. Well, of course, that's the ideal. Di ba? Unfortunately, the reality, sabi nga natin, totoo lang tayo dito, no? The reality is minsan very one size fits all, no? Depende sa programa. But that's something that we're trying to work on here in the university to make that APE more relevant and more telling of the health of our community. Tiyaga lang muna po tayo, unti-unti. We're doing some changes, some reforms, but hopefully in a short time, we should be able to customize even more, no, for different sectors of the university according to, sabi nga ni Doc Izzy, according to the occupation hazards, mas matetest natin yon, no, kung mas kailangan mag-emphasize sa visual, sa hearing, sa dexterity, sa balancing, or yung mga, and then of course, yung the regular, the blood pressure, blood sugar, etc.
We have a question. So far, we've been talking about physical exams like vital signs, etc. But how about laboratory exams? Do we also offer this during APEs?
So for physical examination, so if we're going to ask if there's a standardized APE package, actually there's none. If you check the law, there is none. It's not a standard examination. Sinasabi ng batas is there should be at least a physical examination, a history taking. Depending on the LGU, they might request na rin for chest x-ray fecalysis. But if you look around at the different diagnostic centers, the basic or the standard APE package is what they call basic 5, no? Which includes the complete blood count, urinalysis, fecalysis, chest x-ray, and the physical examination of the patient. Depending on the age, we add in other tests. For employees above the age of 35 or above, no, we include an ECG. For females over the age of 21, we recommend pap smear and breast examination. And depending on the employees' risk factors, we add in additional tests. As I mentioned earlier, additional hearing tests, so those can be your pure tone audiometry tests, no? Or kaya, if we know that the patient has a family medical history of diabetes, we add in fasting blood sugar. So we can add those requests to the APE package depending if, number one, there's risk factors, two, if the package allows for it.
Ayan. Kaya nga mahalaga talaga pinag-uusapan. So again, yun yung punto na nire-raise natin, that we should not treat the AP as something like a conveyor belt na dadaanan mo lang parang sunod-sunod, no? Mahalaga dun at every station as needed, mas may pagpapaliwanagan, may pagkukwentuhan. So it's really, again, ulitin natin, it has to be a real and honest conversation with the health professional. Okay?
So, if you look at it, no, APE is just, it's not general checkup. No? It's an instrument that we can use to, not just for compliance, no? We use it to assess kung fit ba ang employee for a specific work. At the same time, it's a way for us to check if they can safely do their work all at the same time.
Oh, interesting. So, hindi lang general health, but are you actually fit and safe to do your work? So, malinaw po yun, no? Ating mga ka-RK. Okay? So, linawin natin yun, no? Hindi lang siya nagja-general check-up, no? Sana, magawan natin yon. Okay? Mga katipuneros. Okay?
Tapos in that sense, parang preventive na rin siya, no, Doc?
Yes. Oo. Okay, so anyway, napunta na po tayo doon, no? Napunta na tayo doon. Ano nga ba ang sinasabi ng batas? Okay, can we touch a bit more on that, no? In terms of in protecting the workers, and particularly this instrument we call the APE.
So, as mentioned before, that APE is required under the occupational safety and health standards. And this is further strengthened by RA 11058, which is the OSH law, wherein employers are required to do periodic medical examination of their employees. How often and what's the scope depends on the type of work or the nature of work of the employees. So for, let's say, office-based, what most industries have, no? Annual physical examination would be enough. But let's say you work in a more hazardous environment, like what? Mining, no? So those requires additional tests. So depending, we add in test blood works for lead, mercury, or we increase the frequency. Instead of once a year, you do it twice a year, because we want to monitor the patients, no, and see if their constant exposure to these hazardous situations or environments is causing harm to these employees.
Yeah. So talagang kailangan, no, nagmo-monitor talaga. Okay.
Yes, because it's also part of the duty of the employers that they have to make sure that their employees are safe. And if they are exposed to hazards, they control those hazards.
Nako. Well, mukhang kailangan talaga tignan natin 'yan, no? Kasi sabi nga, the APE can help, no? Can help in identifying if our exposures from the hazards in the work environment are already causing damages, no? And hopefully we catch them early enough to hopefully stop the process of damage or to mitigate if the damage has been done already.
But it's not just the company or the university protecting itself legally. It's also genuinely investing in the health of the employees.
Yes. So, when you talk about occupational health, in terms of not just APE, it's we try to see not just how the work affects the employee, but also we look into how the health of the employees affect their work. So, if you look at the definition of occupational health with WHO, it's just not the prevention of illness and the injury, but it's also making the workplace safer so that the employee can keep on working. Because we want them to be able to have a productive life.
Talaga nga naman, no? Kaya nga, tama-tama to wellness ang habol natin. No? So, the APE has to come from a position of care, really, no? Not just of compliance, no? And that will actually make a difference. Kaya nga, here sa HCW, wadalas natin pag-isipan to, no? We try to look at how we can improve not just the clinical services, but also now trying to make sure that we have programs that will touch heavily on prevention, no? So how do we reduce the risk? How do we minimize the hazards? How do we make sure, no, that when employees go back from illnesses, they can actually safely go back, no? Off topic ng konti, pero maybe something similar, di ba? Ito yung dahilan kung bakit humihingi tayo ng clearance from the doctor, but yet kailangan magkaroon ng clearance from the clinic. Anong difference nun?
So the difference that we provide is, well, what we get from the doctor is medical clearance, meaning they are free from the illness. What the clinic provides is their what we call fitness to work or fitness for work. No? Basically, it's going to what we do is we check and see if they are physically and medically fit to perform their work. At the same time, it ensures that when they perform their work, they're able to do it safely.
Yan. So yung tinatawag natin sa tertiary level of interventions, no, the rehab and reintegration, which often yun yung nakakalimutan, no, in a health what do you call this, a doctor-patient relationship, no. Hindi enough na sabi, ligtas ka na sa sakit mo. Kailangan din ma-evaluate kung ready ka na makabalik sa trabaho mo at kung kaya mo nang gampanan yung trabaho in a safe and in an optimal manner. So, yun po yung gusto nating pangalagaan, no? Kaya, bakit magtataka? Bakit gano'n? May clearance na ako sa doktor ko. Kailangan pa akong dumaan sa clinic para for another clearance. That delays the process. It's not a delay. That's why nagpapauna na po agad kami na gano'n. Pag nagkasakit na mahaba, lalo pa ako na ospital, inform us so that we can guide you and therefore hindi kayo magkakaproblema or madidelay sa pagbalik sa trabaho. Kasi gusto rin namin makabalik agad sa trabaho, no? Pero gusto namin pagbalik, kaya mo na at hindi ka madidisgrasya. Baka mamaya nahihilo ka pa pala. Tapos driver ka pa, ang role mo pala driver. Mahirap 'yon, di ba? So yes, yun yung gusto nating sabihin, no? Though we are not here to talk about compliance, no? Legal compliance. We want to have a genuine assessment of care so that we can protect members of our community, employees, students alike.
And hopefully we don't see these procedures as delays or hassles, but rather as safeguards to the health of the employees.
Alright. Interesting pala talaga yung trabaho mo, Doc Izzy, no? So, and maybe just a bit more, no? So sabi mo nga kanina, intersection ng health at saka ng workplace. So could you, para doon sa mga interesado dyan, no? Baka naghahanap ng yung mga bata na gustong maging doktor, naghahanap sila ng usual specialization, gusto nila cardiology, surgery, etc. etc. Baka bigyan mo naman ng konting insight. Ano ba talaga yung occupational health specialist?
So, as mentioned earlier, no, we are at the intersection of work and health. So, if you ask kung anong field occupational health, it's under the public health and preventive medicine field, no, wherein it focuses on the workforce, wherein we try to protect the employees by the prevention of illnesses and injuries in the workplace. Now we not look into the health of the employees, the condition of the workplace. So hindi lang kasama dyan ang physical condition. We also look into the psychosocial aspect of the workplace. So we look into paano yung work demands, no, the structure of their work organizations, no, and then we also look into the environment itself, no, so the surrounding environment of the workplace, because it helps us develop programs on how to control the hazards that may affect or are affecting the employees. If you're going to ask, how do you become an occupational health physician? So you do the training as a doctor. Once you get your license, no, you can take up the basic course in occupational medicine. This is only in the Philippines. Ibang storya na po pag other countries. So you take up training with the Philippine College of Occupational Medicine by taking up their basic course in occupational medicine, or you can take up training with UP Manila through their postgraduate course in occupational health. Those are the two programs that's accredited by DOLE. Once you take up that training, you are an OH physician.
Yeah, so yun ang specialist for occupational medicine na yun.
It's not yet the specialized program. It's just like a stepping stone, the beginning step.
Okay.
Because for you to be called a specialist in occupational health or occupational medicine here in the Philippines, you have to take up what we call diplomate courses or advanced courses in occupational medicine. You can also take up residency training in occupational medicine. So far, there are, I believe, 2 hospitals that offer that. One in Laguna and one in Pampanga. So, of course, after you take their diplomate examination, no, and you pass, then you are considered an occupational medicine specialist.
Yeah. Pero interesting rin yung range pala no? Parang dapat, aside from medicine, medyo kailangan marunong ka rin ng physics, di ba? Lalo na pagka tinitest mo na yung sinasabi ng mga, at least biophysics, no? Then, imagine mo that trying to understand yung mga exposures to, let's say, what do you call that? Toxins, environmental toxins, no? Kung occupational hazard yon, pag ikaw yung occupational health physician, kailangan mo talagang alam yon, yung ano mga sintomas ng mga na-expose sa mga ganong hazard. Okay, so yung mga general practitioners, yon, pwede sila mag-train or kumuha ng mga courses that you mentioned.
Yes, so general practitioners can take up the basic training in occupational health. So, matatawag sa kanila, once they take up the basic course, no, and they pass, they are what we call GPOH, General Practitioner Occupational Health.
Okay. Wow, that's good. Okay, sige. So, balik tayo dito sa APE. No? So, after the APE, what happens?
So, yan na. Depending on the patient, if they come in, no, they see their results, they get their results, minsan nagpapanik yan. Bakit? Yung results either nakalagay normal borderline, abnormal, no? And sometimes, since hindi sila nagpapakonsult, na-mislead sila as to what it means. So, what it means basically, if it's normal, doesn't mean you ignore it. You still monitor it, even annually. Borderline, basically, you have to monitor it more frequently compared to, let's say, it's a normal. So, but probably you need to have another round of testing or examination after 3 weeks or even 3 months to 6 months, no? So, if of course abnormal, yun, papacheck up ka talaga.
Kasi minsan gano'n sinasabi, borderline naman, okay na yan, next year ko na ulit yan tignan. Di ba? Nangyayari yun Pero yun na, babalik tayo. Kung nasa history mo, family history mo na mataas lagi, may mga lahi kayo na, may mga members of the family na talagang nag-high blood, naggagamutan pa, tapos ikaw laging consistently quote-unquote borderline, mas talagang mas hindi lang dapat once a year ka magpapacheck. Okay? Ganon din yan. Sasabi, pag takot yung mga tao, pag tinanong mo, kumusta ang blood sugar mo? Borderline. Ayaw nilang marinig yung salitang pre-diabetic or diabetic, no? Borderline na lang yung sasabihin. Parang si Madonna lang sila. But anyway, so, sabi mo nga, kahit na normal, hindi ibig sabihin babaliwalain. And I suppose that's where the conversation again and again, no, inuulit-ulit natin, magiging mahalaga for the both the individual employee or patient and the larger company or the university community in our case. Okay.
So, Doc Izzy, what are the most common findings pala ng APEs in the university?
Okay, so what are the common findings, especially in our population, no, wherein a lot of us are doing desk-related work, no? So, most frequent findings and paulit-ulit na nakikita natin sa APE results na even of the different campuses, no. Number one, talagang samba ako dito. Number 1, obesity. Okay, in terms of numbers, around 50% of the workforce ng school is obese based on their BMI, no. Next is the finding of elevated BP. Hindi pa sila confirmed as hypertensive, but during physical examination, they are found to have elevated BP. Next is may findings sa ihe. May it be may UTI, may protein sa ihe, or may sugar sa ihe, or kaya may dugo sa ihe. No? So, those are the common findings in the APE. Of course, another common findings, especially in females, is anemia, mababa yung pula ng dugo. And oftentimes, this is overlooked.
Yun nga minsan kaya ayaw mag-follow up ng iba, natatakot kasi sila na pag kami mga ganun, lalo pa minsan yung ibang reports kasi naka-red, 'di ba? Naka-highlight ng red. So pag may nakita silang ganun naka-highlight or nakalagay may arrow na pataas, ibig sabihin elevated o mataas, takot na silang mag-follow up. So, yung sinasabi po natin, huwag po kayong matakot mag-follow up. Kasi, sa pag-follow up, mas mapag-uusapan natin at mas mapaipapaliwanag namin kung ano ang significance nun para sa inyo at anong pwede nyong gawin at kung ano naman ang pwede rin naming maitulong para matugunan kung ano yung mga magiging pangangailangan base doon sa resulta ng inyong test and examination. So, again, we want to make that very, very clear. Our goal is not to penalize employees, not to prevent you from working. What we really want is to make sure that you are going to handle the regular work and even the occasional stresses that will result from your work, no? Kung high pressure load pala yung trabaho mo, tapos hindi mo minomonitor yung blood pressure or dinideny mo yun na tumataas yung blood pressure, hindi rin nagpapa-check sa clinic, then hindi ka namin matutulungan. It has been the practice of the university clinic to follow up on patients, no? Kahit na gumaling, gusto namin nalalaman, okay ka na ba talaga, no? Hindi kami natatapos po na, ito na yung reseta mo, go. Meron po i-email or magme-message, magte-text sa inyo, tatanungin, kumusta na, kailan po kayo babalik. No? Again, the goal is not to tawag mo dyan, cause alarm. The goal is not to make you feel threatened na mawawalan ka ng trabaho, but on the contrary, it is a genuine care and concern for you. So please, after an APE, mag-follow up po. No, yung iba kasi kinukuha yung resulta ng APE, next APE na ulit. Di ba? So, yan. So, sige.
Yeah. So, through follow-up, especially when you get your APE, is recommended, no? Bakit? Hindi naman kasi laging agad diretso, pag-prescribe kami ng maintenance meds. No. It depends on the findings. Sometimes, kaya nating idaan sa lifestyle changes. So, when we say lifestyle changes, so probably we need to improve your diet, add in more vegetables, change or lower the fat content or the salt content of your food, or probably we might have to add in more physical activities, no, more exercise, or we can recommend some other stress management methods, so that you can get better without the need of medications.
So ayun, the AP result is really just a starting point of your health journey. Health journey talaga.
Starting point talaga.
Starting point.
It's not a verdict or a sentence, di ba?
Yes. Punta tayo sa isa. Ito, medyo controversial, medyo tricky. Questions about mental health. Paano yung burnout? Is there such a thing as burnout?
So, if you're going to ask about burnout is actually recognized in the field of occupational medicine. So, what it is basically is that it can be described as a chronic workplace stress condition wherein the stress is not successfully managed by the employee, and it can present itself as either physical exhaustion, pagod, lagi, fatigue ang employee, paminsan reduced professional efficiency. Bakit? Pagod walang energy. Or kaya medyo nag-iiba yung personality, nagiging sarcastic, or kaya negative.
Mga irritable, no?
Yes, ang personality. And it also has some form of physiological correlation. So, hindi lang siya dahil pagod yung employee, but there is really something going on with their body rin talaga.
Minsan ganun may darating, no? 140/90, 130/90, tinutulungan mo mag-lifestyle changes, no? Minsan, parang ang feeling kasi automatic gamot agad, no? And then you realize, teka muna, saan ba nanggagaling yun? Bakit laging high normal, quote-unquote, no? Not necessarily yet hypertensive, but pwedeng pumunta doon, no? So, kung hindi yan pag-uusapan properly in the follow-up consultation, mamimiss yun na yung pala, nagba-burnout na pala, dumadalas na pala yung what is, we talked about a while ago, yung stress at work or a stressful work environment. So, yan, kailangan din ma-address yan. So, hindi lang siya physical na hazard, meron din tayong tinatawag na mental health hazard.
And it seems that these things are very connected, no? Like poor sleep is related to, I think, metabolic health. Tapos stress din siguro raises blood pressure, di ba?
Yun. Kasi yung mga data na yan, no? Pag tinitingnan natin, hindi natin agad pupuntahan yung numero. Tulad ng binanggit natin kanina, no? Kailangan maintindihan the context of those numbers, no? Yun pala, kaya pala lagi palang puyat. At pag tinanong, bakit laging puyat? Lagi pala nag-overtime. So even that, no? Subject rin yan dun sa field ni Doc Izzy, which is occupational health. Okay?
Okay. So, to employees listening, if you're going for APE and you're asked, how are you doing? Our advice is to take that question seriously. Diba? It's not just small talk. Our doctors are genuinely concerned about how you are doing.
Yeah.
Yes. So, when you're asked, how are you doing? It's not just ano yung pakiramdam mo physically, no? You can even tell them, I am under a lot of stress, I'm always tired, no? Because you have to raise things that may not be directly or can be directly correlated to your work, but can affect your work.
Yeah. So, yun. Correlation versus cause and effect. Okay? So, dalawang magkaibang usapin yan. Oh, wow. Dami natin na-cover. Parang, and mukhang marami pa. Okay. Meron kayang mga nagtatanong? May nakikita ka ba? Mga tanong dyan?
Wala pa namang questions, Doc.
Wala pa naman. Okay. Sige. So, but again, just the same, no? We're almost done here. Maybe it's time to also well, sabi nga, to bring this home, no? So, tamang-tama, na-tempo lang naman, no? Hindi naman natin sinasadya. Nag-announce ka na, Doc Izzy, ng ating upcoming AP. Actually, may natapos ng unit, right?
Yes. So we have completed the annual physical examination for the basic education cluster. We released a memo today regarding the annual physical examination for eligible higher education employees and central admin and support units employees for Loyola Heights campus.
Loyola lang to.
Yes, Loyola campus, because we are already done with ASMPH campus.
Sa Ortigas?
Yes, Ortigas. And our Rockwell and Salcedo or our
Campus.
Makati campuses.
Aba, marami na palang na-cover, no? So, again, no, for the upcoming APE here in the Loyola Heights campus, so yung mga eligible po, so linawin na lang natin. Well, for now, of course, we're trying to work out modifications and hopefully better packages, no? Medyo hintay lang po tayo ng konti, no? Because like what we said, no, we want to make things right, except that there are different considerations, no, that and barriers as well that we're trying to address to make our APE packages more relevant, as we said, no, and more effective and efficient as well. Okay? Alam ko, nasasawa na siguro kayo lagi naririnig sa akin yan na it's coming, no? Pero, yes, we're really working on it. Medyo hintay lang po ng konti. But just to reiterate, yung mga eligible employees, and we're talking, for now, we're just talking about the regular full-time employees muna, no? Regular, full-time, non-project, no? Pagka-project, medyo, pa po, we're still working on that. But for regular full-time employees, you have your sa HE and sa KASU, you will have your schedule in 2-3 weeks, I think?
So, the start will be September and it will run until October.
Okay. So, bantayan na po natin yan at sana yung discussion po natin today makatulong in terms of, not just in terms of our attitude in participating in the APE, but also what happens after the APE, no? Na sana mas bigyan ng pansin, not just the numbers, but the overall assessment, which is really after the total well-being of the individuals and eventually of the entire university community.
Also, as a reminder, we ask that you bring your old APE results during your APE. Why? Sometimes kasi we look into, is there a trend in terms of the results of the employees?
Oh, yeah.
Kung may persistent bang dugo sa ihe, mga ganon, or persistently umaangat yung BP, then that is something that needs to be reevaluated.
Your history taking talaga is really important.
Yeah. At saka yun nga, yung sinasabi natin, no, it's a resource. The APE evaluations, no, resource yan, no, in terms of the information that will be necessary, not just to address your individual and specific needs, but really how to create more appropriate programs for the entire university community. Okay? So we hope that every employee will feel, no, that this APE is not just a compliance issue, but rather a genuine act of care for each one of you. Okay?
Alright.
So, may mga ano na ba? May mga questions na ba sila?
Siguro we have some final questions na lang. We can take 2 questions. Number 1, I missed last year's APE. Do I need to catch up or just wait for this year's?
So, advice namin, number 1, do not wait. No? If you missed the APE for this year, reach out either to HR or to the HCW or University Clinic to check if there's a makeup schedule. Or you can also visit us in the University Clinic so that we can do a assessment immediately. What's important is at least magpa-check up ka at least once a year.
Yan. Kaya nga, yung mga sumali sa sports fest, no, buti na lang, sumali kayo. So, nagkaroon tayo ng pagkakataon, ma-evaluate kayo. No? So, we're just so happy that many people are participating in the sports fest. No? But that's also, in fact, an objective of the sports fest, no? Because we require people to get a health clearance before you can participate. Para na rin kami nagpa-APE sa inyo, no? Na nauna. So, yes, tuloy lang yan.
Okay, second and last question. I feel anxious before APEs because I'm scared of what they'll find. Is this normal?
Normal, well, yun nga, sinasabi natin, huwag kang ma-anxious, no? Kasi we're not out to get you. We really want to be able to help you manage your health. Again, we're helping manage your health. We're not making decisions for you, but we can provide guidance based on the evidence that we are able to gather through your APE. So, kung wala yung check-up, wala yung APE, wala kaming masasabi na magiging substantial at more importantly, yung magiging relevant para sa'yo.
And true, sometimes nare-relieve rin yung mga tao after APE. Why? Because na-examine na sila. So they get to know if they have conditions. And if they do have conditions, is that, are they managed?
Yeah.
Alright, so...
Yun na ba yun? Tapos na ba tayo? Wow, parang ang bilis rin pala. Isang oras na yan. Okay, so again, reminder, no, for full-time, regular employees, lumabas na po kanina yung memo regarding the schedule of the APEs, no? That's, again, for higher ed and for KASU units, no? Tapos na po si Basic Ed, tapos na po si Rockwell and Salcedo Campus, tapos na rin po si Ortigas Campus. Okay? Any parting words or reminders, Doc Izzy?
So, once again, no, your health and your work are connected. They are not separate from each other. And that APE exists to protect that connection in order to make sure that you are able to do your work safely, sustainably, and you can do work for a long time. So it sees you not just as a employee, but as a whole person.
Yan. Wow, whole person.
Whole person talaga. So for any questions, concerns, or if you want to schedule a follow-up consultation after your APE, you can reach the HCW via programs at hcw at ateneo.edu. Students can visit the school clinics, employees the university clinics. For emergencies, go to the nearest clinic immediately.
Okay, so just remember, your health is not just your concern, but it's also our concern. And it is not the goal, but a resource so that you are able to keep up with the changes in the environment, to be able to achieve your aspirations and goals. And also, no, remember, protecting the community begins with keeping individuals healthy. And when we keep the community healthy, we in turn keep the individual safe and well. Okay? So I guess that ends our session for today, and we will see you again next month or on the fourth Wednesday of September.
Wow, September na kagad. Alright.
Alright. Good night, everyone.
We all want to live healthier in mind, body, and spirit. But where do we start? Sometimes all it takes is a good conversation. Tune in to Wellness Wednesdays on Radyo Katipunan 87.9 FM. Together with experts, inspiring guests, and real stories, we explore tips you can actually use. From managing stress, to eating better, to finding balance in a busy world. Because here, we believe wellness isn't just about living longer, it's about living better. So join us, and let's make every Wednesday a step toward your healthiest self. Wellness Wednesdays, wellness that speaks to you. From the body, mind, to might. Every Wednesday on Radyo Katipunan 87.9 FM.
Radyo Katipunan. News, insights, inspiration. Radyo Katipunan. Down from the hill and down to the world. Radyo Katipunan. The voice of the blue